My name is Joey Alge, and I graduated from First Baptist in 2002. Yeah, so my wife, Micah, and I, and our four kids, Eleanor, Lydia, Lewis, and Polly, live in Houston, Texas. We moved here in 2015 after I graduated from the MD PhD program at the Medical University of South Carolina. Moved here so I could pursue my postgraduate medical training at Baylor College of Medicine and Texas Children's Hospital, where I am a senior fellow in pediatric nephrology. Yeah, well, I would say that I didn't realize it at the time, but I was really profoundly impacted by the chapel services. And as I've been raising my children in the faith, I frequently reflect back on the messages, the skits, the songs. Sometimes those really come in handy as I'm trying to communicate more, deeper, more complicated subjects with kids, because I was not raised in the Christian faith, and so that was kind of my exposure of how to pass on the faith to children. It's not been disrupted per se by the COVID-19 pandemic. Medical practice looks different now, but we're still doing everything that we normally would do. It's just a lot of what we're doing now is telemedicine, where we were previously doing everything in person. And honestly, that's been kind of neat to see that roll out, because people have been talking about it for years and how good it would be for our patients. And now we're doing it as a protective measure to limit people's exposure. And I would say that I think that it's working well, and it's I think one of the real positive things that's come out of the pandemic, just to limit exposure potentially to my family. It's self-isolation, not quarantine, because I'm not sick. But one of the big I guess really important piece of information that we've learned over the past month is the importance of asymptomatic carriers in spreading coronavirus, and that's one of my concerns. Is either before if I were to get sick before I start showing symptoms, or if I'm one of those people that never show symptoms, that I would bring it home and expose them. So I think the most important thing that people can do is to listen to local, regional, and national authorities and their recommendations on social distancing. The reality is that if we don't limit the spread of the virus, or slow it down, that there's no hospital system, no matter how well equipped, that will be able to take care of the surge of sick patients that we would see. And so that's the part that everyone in the community needs to play is social distancing. And then secondly, if people have personal protective equipment, face masks that are high-grade N95 face masks, gloves, things like that, I would encourage them to donate to their local hospital, because there is a national shortage of those things, and we need to protect the healthcare workers that are on the front line. Otherwise, we're going to have a much bigger problem.